So what really started me thinking about interviewing you on the subject were the new studies that are coming out now, talking about the relationship between some of these hair treatments that we talked about and cancer in women with textured hair. And I think they were somewhat sensational, some of the things that came across our feeds, but when I was reading them, I became very concerned. So I thought you would be a great person to talk about these studies and, kind of give us the tea on what really is the level of danger here.
So these studies are very interesting, but it's really important to understand the kind of background of the study. So most of the data comes out of a study called the Sister Study. So it's a group of over 30,000 individuals whose sister had breast cancer. So they didn't have a history of breast cancer, but their sister had a history of breast cancer.
Okay.
So they studied these women and they asked them about many different things, but one of the things that they asked them about were their hairstyling practices. So two big headlines came out. One of them was talked about uterine cancer, and it was talking about the use of, it said, hair straightening products. But so when those headlines came out, they would say relaxers associated with increased use of uterine cancer. But what did the study actually ask? So the question they actually asked is, in the last 12 months, have you used a hair straightening product, including a flat iron to straighten your hair, the keratin products that we talked about, which contain formaldehyde, or chemical relaxers, which contain sodium hydroxide or hydroxides in general. And in that group of people who said, yes, in the last 12 months, I straightened my hair, essentially. And they asked them about frequency. So the people who said they had straightened their hair at least 4 times in the last 12 months were more likely, I think I have some notes here, but I think they were twice as likely to develop uterine cancer than people who had never straightened their hair. So that's what that study looked at. It was a little over 33,000 women. Their sisters had a history of cancer, and they were asked if they had used hair straightening products in the last year. Now, obviously, when you know the big picture where they looked at flat irons, keratin, and relaxers, that kind of is a different population of people than saying chemical relaxers.
Yeah, it's not a great study design, really.
Yes, they just are women who have straightened their hair, basically, and they had a higher
anybody.
risk. So we do know for a fact, obviously, formaldehyde is a carcinogen. So the keratin is the Brazilian blowout and the products that have formaldehyde in them are actually regulated by the FDA because formaldehyde is a known carcinogen.
Correct.
But sodium hydroxide is not a known carcinogen. It's an ingredient found in a lot of products, and that's the primary ingredient in chemical relaxers. And obviously, flat ironing the hair, I can't think of a way that flat ironing the hair could be associated, unless the product that you put in the hair to flat iron the hair could be associated with cancers. So it's a complicated study. When you know that background, it's a little bit more confusing. Also, in the study of these people who frequently straightened their hair, 60% of them were Black, 40% of them were white. So it wasn't just Black women had higher rates it was that all of the women who frequently straightened their hair had higher rates of uterine cancer compared to the women who didn't.